And many of these patients are, at any given time, are actually receiving treatment. In many cases, the treatment is topical therapy. It could be ultraviolet light, it could be topicals, but in many cases, eventually it becomes systemic therapy. So the first challenge was, at least here in the United States, one, how to make the decision as to exactly when is the right moment to start systemic therapy. Because that right moment could be very different in the judgment of different specialists. And particularly, it has been different in the judgment of medical oncologists versus dermatologists. In part, the reason for that is the fact that for many years, the only therapy that was available to medical oncologists to treat CTCL was cytotoxic chemotherapy. And we know that cytotoxic chemotherapy is toxic, and second, in CTCL, it doesn't really work. So there was a little bit of a defeatist, self-fulfilling prophecy, so to speak, about starting systemic therapy and not really having any good impact. And that gradually changed with the introduction of safer and more effective therapy. So that's one fundamental challenge. When do we start systemic therapy, and what is the best systemic therapy to start? Another challenge in this disease is to stratify patients according to risk. As I said, for many patients, the disease presents in early stage, it stays in early stage. Patients only need skin-directed therapy for all their lives and nothing else. But there is also a significant fraction of patients who present exactly the same way, present with early stage for a significant period of time. They only need skin-directed therapies. But then they start progressing with more extensive skin involvement, eventually lymph nodal involvement, other visceral sites involvement. How do we know which ones are the patients that are so biologically destined, so to speak, to kind of move on to that more advanced stage? And is there anything that we can do about it? So in other words, we may be able to know who they are, but if we don't have good instruments to sort of prevent this transition, then we may not be able to actually have an impact.